today for the Anxiety Awareness webinar. Okay, so I would like to welcome everyone and thank you for joining us today for the Anxiety Awareness webinar. I'm Vaish and I'm so excited to be here today. And before we talk to you about today's event, if I could please have Srileka, our co-speaker, introduce yourself.
Hi, I'm Srileka and I'm the founder and executive director here at Planner. Hope you guys enjoy our webinar.
Okay. Some general reminders for everyone. You can have your camera off, but as always, we would love to see everyone and feel free to use the chat if you have any questions, comments, or concerns. So moving on to today's event, this campaign aims to educate general audiences about stress management, and anxiety disorders. So we have posted on our Instagram about the different types of anxiety disorders, and now we'll be hearing more about personal experiences and more insight on anxiety. Today, we'll be going over stress, ways to manage stress and anxiety, and hearing from our speaker, Brianna. So Brianna, if you could please introduce yourself.
Yeah, absolutely. Hi everyone, I'm Brianna Carnegie. In terms of what I do, I'm a current first year student at Columbia University, getting my master's in public health and epidemiology with a certificate in applied biostats. And I've always been involved in like public health, always had a passion for highlighting disparities within disadvantaged populations. And mental health is actually something that I'm pretty like new to. I actually started with Mind Out Loud. I think at this point around 6, 7 months ago. And that was sort of my first introduction into the mental health field. And I've been in it for the long run since then.
Awesome. So before we move on to a quick overview on anxiety disorders, I just wanted to go over what Planner Consulting is for those of you who are new to Planner or if you don't know who we are yet. So Planner Consulting is a 501c3 youth-powered nonprofit organization, and we provide free personalized peer mentorship sessions to enhance student health. So we've focused on spreading social media awareness, and we're also working on a few special projects such as building a mental health directory, hosting a mental health expo at UT Austin next year, and continuing to work on our peer mentorship certification process. So if anyone has any questions or wants to join the team, feel free to drop them in the chat, or you can email us at plannerconsulting@gmail.com. But without further ado, let's get started for today.
So what are anxiety disorders? Anxiety disorders and anxiety in general include episodes of sudden and intense fear. These episodes can occur at any time, interfering with daily life and activities, and some can spiral out of proportion and be extremely difficult to control. One of the major types is generalized anxiety or disorder, or GAD, and it's characterized by chronic anxiety, worrying, tension, and can occur even when there's nothing or little to nothing that can provoke it. Obsessive compulsive disorder, also known as OCD, is characterized by recurring obsessions and compulsions. Unwanted thoughts are called obsessions, and repetitive behaviors to combat those obsessions are called compulsions. And some repetitive behaviors include hand washing, counting, checking, cleaning. These repetitive behaviors are basically they're intended to ease the obsessions, but usually they only provide temporary relief, and not performing them can increase anxiety in those that have OCD. Another pretty common one is panic disorder, and this can also be caused by, again, unexpected episodes, and this is accompanied with physical symptoms, and these symptoms could include chest pain, shortness of breath, dizziness, or abnormal stress. Post-traumatic stress disorder, or PTSD, is another disorder that can develop after exposure to a traumatic event, and this can occur when physical harm has occurred or there was threats that were made. Social phobia, also known as social anxiety disorder, is characterized by overwhelming anxiety and excessive self-consciousness in daily life situations. And in its most severe form, a person can experience symptoms almost any time around others. And now that we have gone over a general overview of anxiety disorders, we're going to hand it off to our guest speaker, Brianna. And I'm going to ask, what is the difference between anxiety and stress?
Mhm. When sort of going into sort of like what makes stress different from anxiety, the thing that I mainly saw is that for the most part, everybody experiences stress, to some extent, whether it's because of school, work, relationships. Essentially, you sort of have good stress and bad stress, and you sort of need stress, to an extent to sort of help get you going. And this differs from anxiety in that anxiety is sort of just like a chronic sense of existential dread, like you sort of wake up and you're like, wow, another day of just like existing, and that just gives you a general sense of like dread and like anxiety. That's the best way I can describe it. So in terms of like how you can sort of differentiate between what's stress and what's anxiety, anxiety is typically more severe and chronic. So, of course, if you have like a traumatic life event, like if you're having like SAT tests, or if you're having like family problems, that may cause you some stress. You may experience maybe an elevated heart rate. And this differs from anxiety, where it's very much chronic. And unfortunately, in some cases, it does have the ability to interfere with your daily living activities, whether that's, like studies, family and societal relationships, just general activities that you had fun doing, and now it just brings you dread once again. So just to reiterate, stress typically has a external trigger, while anxiety doesn't really have a trigger. It's just sort of there. It can linger and cause you extremely similar symptoms to stress, but it's just more longer lasting, and in the long run, it can have more severe consequences.
Yeah, I definitely agree. I think that was a great way to put the differences between the two. Um, why do anxiety disorders happen?
Hmm. I feel like for the most part, it is a little bit difficult to sort of figure out what the causal path is between the exposure and the disease or the outcome of anxiety disorder. But in most cases, there are risk factors that would make you more susceptible to developing anxiety disorders, like with most, disorders. So for example, if you have a history of anxiety in your childhood, if you have shyness, that could make you more susceptible to developing an anxiety disorder. Of course, if you also misuse any substances, that can, of course, make you more susceptible. And I'm also not sure if you all are familiar with adverse childhood experiences. I'll be sure to put the link in the chat when I'm finished with my presentation. But the higher number of ACEs, they usually call it, or adverse childhood experiences you have, once again, you are more likely to develop anxiety along with a plethora of other disorders as well. Along with, again, just having a difficult childhood, if you experience any trauma and experiencing any post-traumatic stress disorder, like you mentioned earlier in the presentation, that again is of course more it makes you more susceptible to developing this. And interestingly enough, in some cases, it can also be medical related things that make you more susceptible. So for example, if you have like any vitamin deficiencies, I believe it's B12 specifically, hyperthyroidism, and also if you have COPD, which is chronic obstructive pulmonary disorder. Those are just a couple of things that it's interesting because you can have all of those things and not develop anxiety disorder, or again, you can have none of those things, one of those things, or a combination of those things, and develop this disorder. So it's really interesting to see how all those factors can lead you to that outcome.
Yeah, I definitely think there's several factors that can influence that. Um, what is it like to live with anxiety? Do you have any particular experiences you would like to share, or how have you dealt with it?
For me, I feel like the most anxiety comes with either like relationships or like in an academic setting. Like if I'm ever going to like take a test, or if I have like something like really big coming up, it always just like stresses me out to the point where it's like I just have like an existential sense of dread. Like I wake up like, oh, just feeling, like so drained and so like I don't want to do it, but essentially I know it has to get done. In terms of particular experiences, I feel like I just have a near panic attack every time I'm about to take an exam, which is kind of not that good. I feel like it's still a work in progress. And I feel like something sort of that I like now that I'm outside of like undergrad and I'm in grad school now, is that most of the exams are online, and I have a little bit more flexibility to sort of manage my time and manage the environment where I'm in, versus an undergrad where I was in a room full of people. I can like look at their tests or I can look at their exams and I can see that, for example, they're on like question 30 and I'm still on question 2, for example. Just those sort of things, those can make my anxiety spark up a little bit. And the last question is, how have I dealt with it? I feel like in those moments, I usually drink a lot of water. I'm not sure, but I feel like water, just drinking water, like distracts me for some reason. And I also just try to take like very deep breaths. I know it sounds a little bit cliche, but just taking deep breaths and realizing that, okay, it may feel like the end of the world, but you're gonna get through this just like everything else. And something I've realized with anxiety is that you sort of have a high belief that, again, like nothing is going to go right. And then you sort of have very low, I guess you can say self-efficacy or low self-confidence in your ability to deal with a stressful situation. So I feel like it really all comes down to being able to reassure yourself again that, you got this. You've done it before, or in some cases, haven't done something before, but you just got to look at it over and out.
Yeah, I can definitely relate to your experiences academically. Um, what tips would you give to any young adults in dealing with anxiety?
Tips. I feel like for me, um, especially like being in school and working and everything, it's sort of very easy to become overwhelmed with all the different, like schoolwork and all the different extracurriculars and activities that you have. So something I like to do is I literally write down everything either on a to-do list or using Google Calendar. I'm not sure if you guys are familiar with like different productivity apps, but I honestly love them. Some people say that you focus more on being productive than actually getting the tasks on these apps done. But for me, it works perfectly. So like I would have a block where I set aside time to like study, for example, a block for the gym, a block, even if I want to take a nap, best believe I'm going to put that in my Google Calendar just because it sort of helps me deal with the stress of just having so much stuff to do in a day, and planning it makes it so much easier to get through the day and look forward to the day in a way where it's not stressing me out. Additionally, this may also sound a little bit cliche, but find some time to engage in self-care. Whatever that is for you, whether it's going to the gym or taking a nap or just binge watching some Netflix, maybe ordering your favorite meal. Again, just sort of taking that time for yourself is something that can help with dealing with anxiety. And again, self-care is always great too.
Yeah, I definitely agree with the organizing. I think that Google Calendar, Notion, Hours, all of these platforms are really nice for that.
Absolutely. And there's so many different ones now, like you said, like Notion, Todoist. There's so many. It's sometimes it may get a little bit overwhelming with all these different apps as well. But again, just being able to sort of balance the tasks that you have to complete with the app, it as long as you utilize it correctly or in a way that's most efficient to you, to be honest. I feel like that's what matters.
Yeah, I totally agree. Like creating a system around it is really, really important. And that's what I've done like with my GCal is like I color code it so that it like is the most
Mm.
efficient that it can be. So I love that you pointed out productivity apps, and self-care, in my opinion, is definitely not cliche. Because I feel like it's so important that it shouldn't be cliche. It should be something that we talk about. But yeah, I know therapy is also a very common thing that's talked about as a way to cope with anxiety. What are your thoughts on therapy, and what advice would you give to a young adult going starting to like take care of their mental health?
Absolutely. I feel like therapy, even if you, for example, like don't have any type of mental, illness, mental disorder, mental heaviness, I feel like honestly everybody should go to therapy. Whether that's in person, I honestly go virtually just because I have a lot of things to do on my schedule and it's easier for me to just attend like, via my computer. But again, I just feel like everybody should engage in it, even to just talk about like how your day was, different things that are like bothering you or stressing you out. I feel like sort of as we know, being in the mental health realm, there's like a stigma about therapy that like something has to be wrong with you in order for you to go to therapy. But I feel like we sort of need to eliminate that stigma because e- everybody needs somebody to talk to, And I feel like therapists, even if you were to go to a psychotherapist, which I believe you go for more like extreme cases for like medication, but I feel like it's stigmatized and it shouldn't be. Everybody should go to therapy. I know even now there's a whole bunch of like apps and stuff that they have to sort of make it easier to find therapy near you and therapy for cheap because I know some people unfortunately don't have it offered in their health insurance plan. And I also know that there are a variety of apps that if you also don't want to engage in sort of like being face to face with some person because that may, like creep you out a little bit, they also have like chat features where you can sort of go to somebody for some problems and they can give you like a text response to ease your mind as well.
Yeah, I love that. And I totally agree, especially in like people of color communities. Like I'm part of the South Asian community, and I feel like the stigma is just so heavy that
Hmm.
it's impossible to even take the initiative to reach out for help. And I
Yeah.
love that you also mentioned how like therapy is good to talk about your everyday life because I literally had a session yesterday where I ended up gossiping with my therapist about a situation that occurred with me recently. So like it's so casual and it's so nice to be able to go through
Yeah,
your week and talk about things that have happened to you. So I love that you said all of that. To continue,
totally agree.
how does daily stress impact anxiety disorders? And how do you think that relationship is interrelated, I guess?
Of course, of course. I feel like they're like extremely related, especially being that they have, sort of like the same symptoms, an increased heart rate, confusion, in some cases like vivid dreams, anger, irritability, stress and anxiety. Again, they can look very similar, but one thing that I've noticed is that chronic stress does make you more susceptible to developing anxiety disorder, because the way I see it is that, when you're stressed out, your body releases like cortisol and it sort of puts you in this fight or flight system, which I'm sure you've got to have heard about. Sympathetic, parasympathetic nervous system. I'm going to spare you guys a lecture. This is in biology class. But again, when you're always at a constant state of releasing cortisol all the time because you're stressed out, this can not only make you more susceptible to anxiety disorders, but other anxiety disorders as well. Something that I've learned about in my classes is I don't exactly remember the name of the concept, but it's essentially how people who experience more stress specifically related to race. So, for example, African Americans are more likely to develop have chronic stress and have sort of like a cumulative effect of all that stress that they developed due to any racial injustices, just simple racism that has the ability to sort of like develop over the lifetime and make them more susceptible to things like cancer, heart disease, cardiovascular disease, which we now know is the number one cause of death in the US. And I just feel like it's very interesting how you sort of think of these things as like, oh, like I'm stressed out, but it's sort of like you can't really see it right now. But I feel like it's extremely interesting and almost sort of eye-opening to see that in some cases you may think that it's okay for you to be stressed out now because you'll deal with it later. But essentially, it can make you sicker in the long run. So not only just can chronic stress lead to anxiety disorder, it can also unfortunately greater problems as well over time.
Yeah, I think that the interactions between like your biology and your psychology are so interrelated. So I love um
Yes.
that you touched upon all of that. So second to last question, what can young adults and teens do to raise awareness about anxiety?
I feel like anxiety and even like chronic stress is like so common in today's society. So again, if you ever are having like a anxiety attack or if you're feeling extremely overwhelmed, talk to somebody about it, whether that's, a friend, girlfriend, boyfriend, significant other, lifetime partner, whoever, just talk about it because I don't think many people know that 1 in 5 people in their lifetimes suffer from a mental disorder. And according to the National Institute of Mental Illness, approximately 18% of adults between the ages of 18 and 54 report having an anxiety disorder in any given year. So I feel like it's extremely important to sort of talk about it, normalize it, because again, 18% out of the billions of people in the world, I'm not going to do the math right now, but that's a couple 100,000. So that's a lot of people. Um, and something else that I found really useful is that this summer, actually through an internship I did, I had the opportunity to take place in a mental health first aid training. I'm not sure if you guys are familiar with that, but essentially it gives you the ability to notice the signs of distress and help somebody manage those symptoms. I'll give a couple more details in the next question since I know they're sort of interrelated, but mental health first aid and certainly talking about it as much as you can. And again, even just attending or even hosting events like this one, right now, normalizing the conversation, inviting people to sort of talk about how this is very commonplace and it's nothing to be ashamed about.
Yeah, amazing. And on the mental health first aid stuff, I'd love to learn more about that. I'm sure all of us would, in how you get access to those resources where you can learn techniques. So for sure,
Absolutely.
that is a perfect lead in for the next question as well, on how can someone help a friend with anxiety?
I feel like mental health first aid is like a huge, huge way to sort of deal with these things on a more on a deeper level because I feel like you hear these things and it's sort of like, oh, like talk to a friend, check in with them, ask them how they're doing. That's great and all, but I feel like there's certain tools that you never really know how to sort of do unless you learn about it and you practice how to do it. So again, mental health first aid, it equips you with the certain tools and knowledge that you need to not only notice the signs of distress in an individual, but also manage the signs of distress. And it also gives you the knowledge that you need to identify multiple types of mental health professionals, as well as self-help resources for people with mental illness, addiction. And last but not least, it also helps you increase your own self-efficacy to sort of know that you are well equipped with the tools that you need to handle anybody should they be experiencing a mental health challenge.
Yeah, I totally agree. I think that it's helpful for yourself to also learn those techniques. So thank you for that.
Absolutely. Of
Um,
course.
and then before we move on with the rest of the webinar, if anybody has any questions, feel free to ask in the chat now. Or we can also wait till the end. So like don't worry about us missing your question or anything. We will.
Actually, I have a question. Do you think anxiety is always a bad thing?
Is that question for me? Oh, I'll just go ahead and answer. I feel like it's not like the greatest thing to be quite honest, because it's not a very comfortable feeling, you know? Like you sort of feel like mentally overwhelmed, overstimulated, and it's like you're not sure how you're going to sort of get to the next part of your day. But I feel like in some cases, it certainly has taught me how to be more in touch with like the mind and the body connection. So I feel like while it does, of course, have like its negative physiological consequences, it does have the ability to sort of teach you more about how to deal with your own stress, manage your own stress, and yeah, I feel like that's been the main, I guess, benefit of this double-edged sword that you call anxiety.
Yeah, thank you.
I see, of course, of course. I see somebody in a chat asks, how have you been able to pinpoint what triggers your anxiety and what coping mechanism can help with it? I feel like the number one thing that I do when I'm experiencing like an anxiety attack or I feel like I'm about to have one come on is sort of noticing my environment. So for example, if I'm in like a large crowd of people and I start feeling like like I can't breathe and I'm starting to panic, I notice that of course, again, I have to leave said large crowd of people because being around too many people at once is a little bit scary and just sort of remove myself from that situation. So I feel like one of the main sort of strategies that you can use to pinpoint what triggers your anxiety is again noticing what environment you're in and just making note of those triggers so that you can either try to remove yourself from your situation or if you can't do it right now, make sure that for next time you're able to, as much as you can, avoid being in another situation like that. You're very welcome.
Okay. If there are any questions at any point, feel free to drop them in the chat. But Vaish, I'm gonna pass it over to you to talk about stress management.
Okay, so stress and stress management. So what is stress? Stress is basically like the result of several changes that can cause strain on the body, which is like these strains can be psychological, emotional, physical. There's several different types of stress. Everyone basically experiences it at some point in their lifetime. And ultimately, it's the body's response that determines your well-being. And there are two major types of stress. Usually they're categorized as chronic stress and acute stress. Acute stress is more short term and could be beneficial. It's also common among many and could occur like at any point. And the right amount of acute stress can be beneficial to brain performance. Like Brianna mentioned before about anxiety, it's kind of like another double-edged sword. Chronic stress is long-term and can cause severe mental health problems and can take a huge toll on your mental health. And different ways to manage stress. This could include, as mentioned, self-care is a really great way. Breaks while you're working, like it could be small breaks. I know there's a Pomodoro technique that you could use when you're studying, and that really helps break down your settings so you're not overwhelmed. And also making plans, like you said, using GCal, Notion, all that stuff to stay organized, even a piece of paper to write down everything or Apple Notes or whatever you could use definitely helps with staying organized. Journaling, I know that's been a pretty big thing recently. There are about a lot of prompts you can find online and journal about, and it's pretty calming. It's really nice to try out. This is not on the slides, but like drawing, I always found art and painting and stuff to be really calming. Physical activity is also a good one. I know some people will be like, why? But I really think physical activity is a good way to let off some steam. And also breathing exercises are a really nice way to let go of stress and really calm down for a while. And now we're gonna go over some breathing exercises that are pretty simple and easy to do whenever you want to. So I'm gonna hand it off to Shrulika.
Awesome. So just a reminder, if you do not want to participate, no worries. We're just going to go over the breathing exercises, and then we'll be sending out the slide deck as well as the link to the video later on. So you'll have access to these exercises. And then also there are plenty of breathing exercises online that you can find as well if you want to do like a guided meditation or mindfulness thing. But I'll just quickly go over to you that you can try out in your own time. So the first one is the pursed lip technique. So you breathe in through your nose for 5 seconds and then breathe out through your mouth. But when you breathe out, you have to breathe out for 10 seconds, which is twice as long, and breathe out with pursed lips. And this one is great to calm your heart rate down. And yeah, I would definitely recommend using this one for sure, as I have personally used that one, as well as square breathing, which is a different one. And then we also have 4, 7, 8 breathing, which is you inhale for 4 seconds, hold for 7 seconds, and exhale for 8 seconds. So another great one to try out. And again, these slides will be sent out, so you will have a copy of these so you can do these breathing exercises. But yeah, we just wanted to share some tools for you guys to cope with anxiety and daily stress as well. Yes, 478 is great for sleeping as well. I agree, Rihanna. That's such a good point. Yes, okay, so I think we're nearing the end of our slides. But before we all leave, if anybody else has questions, comments, concerns about anything, feel free to put it in the chat. Vaish.
Yeah, so everyone, thank you for coming. I would like to thank Brianna for her awesome insight on anxiety. I thought your responses were really great and pretty relatable. I definitely agree with what you said. And also, I would like to thank Shrulika, our co-speaker. She definitely helped me a lot while planning this webinar. And I hope you all really learned something today. And yeah, have a great day.